Hello, this is Connie Welch with LifeBeyondHepatitis.com. I just wanted to give you the week 11 update for treatment for hepatitis C with using the protease inhibitor Incivek. It has actually been 3 weeks since I've been off of Incivek, and so I continue on with the Ribavirin and the Interferon shots. I'm currently still taking the Procrit shots once a week to get my red blood cells built back up to where it needs to be, but that is definitely improving. I went to my doctor this last week for my checkup, and he was greatly encouraged by my blood work. My red blood cells continue to go back up. My liver enzymes right now are in normal limits, which is very good news and stuff. So we're very excited about that. My white blood cells are still the only thing that's still pretty low. And so he continued to caution me about being around a lot of people, especially if I know I'm going to be in a situation where be around more people that may be sick. He did caution me also about the summer heat. That he said during the time of doing any type of chemotherapy, a lot of patients where the heat would be especially bad, zap you of energy. It really does it more if you're out in the heat an extended period of time. So he really cautioned me try to not to be out in the heat any longer than absolutely necessary. Also, he cautioned me about mosquitoes. Here in North Texas, we've seen some cases of West Nile virus already appear. So he was very much cautioning me about that, taking the precautions necessary not to be around an area where there would be more danger of more mosquitoes, but to use some preventative measures for that. So, he just was saying that during treatment, if you were to get sick with a virus or something, that it just kind of works a little bit harder on you, to get over. So he was just cautioning me about that. But other than being off of the Incivek for 3 weeks, the heavy metal taste that I was experiencing has gotten tremendously better. My appetite has started to increase a little bit. I'm still only able to eat small amounts at a time before I start feeling very bloated and start to feel like I may be starting to get a little sick at my stomach. So I just stop. I just eat small amounts at a time, and that's okay. I think my system is still very sensitive to the medicine, and so you just kind of have to take a little bit at a time. But it's so much better. It's tremendously better from where it was about 3 weeks ago. So yesterday, I really had a victory day. I was able to, my energy has been up yesterday and today. I was able to go out and run some errands, go to the store, and do some different things that I needed to get done. And so I was very excited that I felt so much better. While doing this treatment, one of the things that I've seen that's been very consistent is that energy will fluctuate. That you're going to have some good days, and you're going to have some days that you totally feel like you're just need to go to bed. But it fluctuates within that, and you just have to understand that's just part of it. But if you're feeling good, enjoy it for the time that you have it and stuff. And then if you are having a day where your energy is very low, then just know that it's temporary. It's going to pass and it's going to get better. So I have continued to take the B12 sublingual tablets and the vitamin C to kind of help boost my immune system and energy level, and I think that's helped as well. I wanted to say that next week on July the 2nd is when I'm going to be doing the next virus load test. So that's a real big date for me to be able to get that done, that next virus load test. Since I had a non-detected test done at 4 weeks, we are very hopeful that this one will show non-detected as well, and hope and pray that it does. But the doctor will take that into consideration. Plus, he will do another virus load test the first part of August. And then he said he will determine whether treatment for me will go until just the end of September. So that would be a total of 24 weeks. So that is to me a real blessing and a real gift, because if that does happen, that shaves off another 3 months of treatment. But we will just have to wait and see whether I will have to go longer. He really related to the fact that I had a non-detected at 4 weeks. So at this point, we put the guard dog out. And, you know, this is a time to kind of be swooping up all of the hepatitis C virus cells that may be left. And so the ribavirin and interferon is working, but just still dealing with some of these treatment side effects. But it's definitely, I feel very encouraged today, and it's definitely getting better. So just want to encourage you, and stay tuned this next week when I'll give the next 12-week update. So see you soon. All right, bye-bye.